Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome, everyone, to our weekly podcast, Redefining Medicine. We are very happy to welcome Kristen Coletti Giesler, a certified family and emergency nurse practitioner, co-owner of Functional Medicine of Alaska, and mother of 5. Welcome, Kristen, and thank you for being with us today.
Thank you so much for having me.
All right, let's get started. Kristen, can you tell us about how you were first introduced to anti-aging medicine and how this led you to the development of your current practice, Functional Medicine of Alaska?
Well, I became a nurse practitioner in 2010, and I decided that we should really try to be in a place that's got a lot of opportunities for growth. So we packed up the whole family and moved to Alaska. Yes, we went from the South, North Carolina, all the way to Alaska. And I went to work in a very small town, Delta Junction, and worked with an amazing osteopath. I did not have very much exposure to osteopathic medicine prior to that. And it was very interesting to see a provider that just encompasses whole body wellness. And it was at that point that I really wanted to be like this wonderful provider that was training me on how to work with patients. It was a wonderful experience in regards to seeing people get well. I had just come from school and my rotations were very episodic. You know, you have this, you get a Band-Aid for that. There was no long-term wellness plans. One of the things that just amazed me is I had a gentleman that had pancreatic cancer. And that is a very scary diagnosis. And he had been given, I want to say you have 6 months to live prognosis. And when I had met him, he was into his 5th year or so of treatment. And that was when I first learned about IV vitamin C. It was amazing to see that. I had never heard of that as a new grad. And to just watch him come in every week to do that full of life, full of vigor, and was a great start to, opening the doors to anti-aging and longevity. It wasn't, though, until I worked out in the bush that I really decided that I wanted to go forward with education and learn more about anti-aging. I was exposed to a lot of Native patients. It was predominantly a Native population, but I noticed this huge disparity between my young patients and my elders. My elders were outliving my young patients. And I just couldn't understand that. How could a 30-year-old have more diagnoses than my elders in their 90s? So I've spent quite a lot of time with the elders. And the first thing I noticed is their diet, full of fruits and vegetables and game meat that they've killed or garden vegetables that they've grown themselves. There was nothing processed in their diet. And when I compared that to my patients that were, in their 20s, 30s, 40s, most of their food was cooked in the microwave and came from the convenience store. So it became very apparent to me that that is what's happening to a lot of cultures, not just out in the Alaskan bush, but it's definitely something that's happening everywhere. I got very close to some of my elders there, and I learned all about different herbs that they would use, learned a valuable lesson not to drink chaga straight after it's brewed. Very, very strong. Learned about some wound care. They would take pitch from the trees and use it on wounds. So that was really a catalyst. I would say being in Delta Junction was a seed that was planted and it just flourished when we were out in the bush. That's how I got into anti-aging.
Thank you, Kristen. You have witnessed how finances can be such a significant barrier for patients trying to access care, especially integrative and anti-aging care. And you are even writing a book series on this topic. Will you provide us with some background on your practice's location and patient base, and then walk us through how your practice navigates these challenges with individual patients?
Yes, absolutely. My pleasure. I live in Kenai, Alaska, which is the peninsula here in Alaska. It's beautiful. And I have a very mixed patient base. It's very important to take that into consideration. My current practice, Functional Medicine of Alaska, is an insurance-based model. I do serve quite a few underserved patients with Medicaid or very low income. I have patients that have insurance but don't have a lot of spending money left at the end of the day. There's lots of challenges financially for wellness in general. My background has always been food first, very nutrition heavy, and it's very important that my patients understand the foundation of good health. What I feel a lot of my colleagues in general fail to recognize is that you can supplement all day long. But if you have a junk food diet, it all comes out in the end, literally. Sorry. So that is something that is very challenging for us is finances. We have quite a few patients that won't follow up with appointments if they feel like they can't do their programs. We had to learn this very early on when we first opened the practice. So some of the things that we have done to ensure that no one's left behind per se, or that they feel that they're being cared for, is we've done a lot of research. And I feel that it's very important to listen to your patients. I do ask financial questions when I do my initial intake, because I know how to approach their food plans, approach their supplements. It has to be very individualized for me. And I explain to them that I don't need to know all of their business, but I need to know how I can help them best. So what we tend to see is they're sick for a very long time and they lack the resources to help themselves to be well. Some of the things that we have done to help our patients reach their wellness goals on a budget is we do a ton of teaching. Do you remember field trips when you were a kid? We do field trips to the grocery store. So we actually teach our patients how to shop on a budget. And we do this frequently, several times a year. We also do cooking classes. It's different when you're used to cooking in a microwave or not eating fresh foods. They need the education. We've also put together many lists of how to afford different things. We utilize manufacturers' coupons versus waiting for the Sunday newspaper. Going direct to the manufacturer, like, looking for organic frozen produce, buying in the summertime at the farmers markets. Those are all things that we do. Utilizing things like Subscribe and Save, Amazon Prime saves a lot. One of the other things we like to teach our patients is to shop in more than one store. It's important that you look for things that are on sale. You have to make a little bit more time to meal prep. Going to the market the day before and the day after the ad changes. It's different days in different stores, but those are some of the things that you can do to buy organic produce, organic meats, pasture raised, things like that, because it is a little bit more expensive than the non-organic options. It's also important to get to know your employee manager or the produce manager, the butcher manager, because they will help you know when things are going on sale. We also highly encourage, number one, I probably should have mentioned this first, is hunting, fishing, and foraging. Most areas have a kill list. Now in Alaska, this is big. We have a lot of moose and we have a lot of caribou. Getting on the kill list, you do get a phone call when there is fresh game and you can pick it up. Very, very big in some of the northern states as well. You can also sign up for proxy hunting and fishing. So if you're not able to do that yourself, if you have a disability or you're just elderly or for whatever reason, you can sign up for a proxy. Planting your own food, foraging. Seeds and water are cheap. I am the frugal NP apparently. Even if you live in an apartment, you can use window boxes. For example, 6-inch deep window boxes you can use to grow things like Asian greens, bush beans, garlic, kohlrabi, radishes, lettuce, green onions, peas, spinach, chard. All of those can be put in a window box. If you have a deeper one, you can grow things like at least 12 or so inches. You can grow beets, broccoli, carrots, cucumbers, eggplants, and the list goes on. As you can see, we try to work with our patients to help them find solutions to feed themselves a healthy diet. In addition to the field trips, we do the cooking classes. We even have gone so far as to hook up our patients with proxies. There's a lot of people out here that are willing to help and are willing to offer that service for those in need. It's a good community outreach. The other thing that I like to do is utilize a company called FullScript. I'm sure most of you are familiar with that, but you can set your supplements to be zero profit or low profit. And that really helps with ensuring that your patients are able to get the supplements that they need if they absolutely need them. And that is just a little bit of some of the things that we do. I could talk to you all day long about things that we do to help our patients have a healthy lifestyle and reach their wellness goals. There's so much poverty, and it shouldn't be a barrier to wellness.
Thank you. Kristen, you've mentioned that your mold sick patients in particular are often underserved. Will you expand a little more on this issue?
Absolutely. It's interesting when you envision your practice when it first opens, you have all these ideas in your head of what it's going to be like. I was going to have this big wellness clinic and prevent. And then the chronic sick, very sick patients make their way through your doors. The ones that nobody believes are sick, they come in, they're mentally drained, they've been called crazy. They have been told they have diseases that are in their head. You need a psychiatrist. And COVID hit, and we make plans, God laughs, and all of a sudden I have to become an expert in environmental illness. With COVID, people in Alaska have been in their homes quite a bit for quite a long time. And one of the biggest challenges with that is mold. We live in Alaska. A lot of people live in cabins, dry cabins. They're moist, they're wet, and it's the perfect environment for chronic mold illness per se. So we see these patients, they're extremely sick, and we have to give them hope. Well, mold is a long process. Most of you know any environmental illness is not a quick fix. It's not an overnight solution. Between medications and supplements, of course, the diet changes, and working on your mental health because you've been through so much being sick for so long. And then at the end of the day, you have a patient that is still going home to their moldy house. It's a huge barrier, and if I had one wish, I would wish for some opportunities to have some of these homes be completely remediated, because it is a huge issue, and it's heartbreaking, and I can only do so much as a provider. I can help them in the clinic, I can help them with their illness, but I can't fix their houses for them. So it's a huge barrier. They're very underserved in the sense that there isn't much options for home remediation here.
Kristen, what advice might you give to practitioners who are considering providing more care access to the underserved patients?
I would say, number one, listen to your patients. Find out what their barriers are to care. It's one of my first questions on my intake form is what are their barriers? And if finance is a barrier to their wellness, then that is something that needs to be addressed. It's probably taken me over 2 years to put together resources for patients, which is one of the reasons I've decided to put this all into a book form, because it's kind of written itself per se. Very important to do research in your community to see what is available. Looking at options for farmers markets, things like community gardens. And if there isn't anything available, why not think about starting one? Looking at co-ops and things like that. There's tons of resources no matter where you are. You just have to look for them. And what I've found is most of the patients that are underserved are hopeless. And it's very easy to take food stamps to the store and buy, a 12 pack of Coca-Cola versus some fresh produce and, some good, organic meat.
And final question. For obvious reasons, this past year has served as a catalyst for change in so many ways, structurally, socially, etc. In what ways have you been most challenged and grown the most in the past year?
I would have to say that with COVID and feeling like I can't do enough for my patients, I've experienced so many families lose insurance, lose their jobs, and they're basically hanging on, and they don't want to resort to their old habits, and they want to be well. And that's been a huge issue for so many of my families. I think that one of the things that I really am looking forward to is working more with, hopefully working with some remediation companies that can kind of come in to our area to help some of these families with their homes because they are getting sicker. Not having resources to buy healthy food has been very challenging, especially when they've lost income. We have done many field trips to grocery stores. We've taught patients how to cook. We've helped them learn how to look for manufacturers' coupons. We've done all sorts of things that you wouldn't think a healthcare provider would do. It's not always just about, seeing someone because they have a simple medical problem. Sometimes you have to help facilitate that change in order for them to reach their wellness.
Well, thank you so much, Kristen, for spending time with us today and sharing all the work you're doing in the community. We certainly appreciate you and your time.
Thank you so much for having me. It was a pleasure. Thank you.